All I think about these days, all I think about these days is getting at that goal that's in my heart. I need a reason to believe in maybe a cure for my disease.
That song is by Blaine Long. My name is Matthew Blades. Meet my friends.
Hi, it's Tim.
And Beth from the Mulhausen Group Real Estate.
We are so proud to sponsor another episode of Learn from People Who Lived It. You can catch us at tmgphoenix.com.
That's a good group of people right there. Hi, it's Matthew Blades, host of Learn from People Who Lived It. And a reminder before we get into today's show that each of these episodes is presented uninterrupted with the support of the Mulhausen Group, with the support of ASI or Advanced Systems Integrations. They design and install cutting-edge audio and visual equipment. So if you're on the IT staff or you're the IT director, please reach out to ASI. This audio visual integrator has offices in Minnesota and in Scottsdale and 2 decades of experience. And the cool thing about them, they pay real close attention to that last 5%, which is the one that drives you and I crazy. We've got a link to ASI in our show description, or you can go there yourself by visiting asi-av.com.
Welcome to another episode of Learn from People Who Lived It.
Oh, yeah. Remember the first time that I reached out to Deidre A? Do you remember the first time I called you?
Oh, yes.
Okay, so I felt like I had an alien growing underneath my left clavicle. It was different than a knot. It was like something weird. And it was just stress, by the way, just so everybody's super clear. But Deidre D came over and she brought this table into my house, and this woman goes to work on my shoulder. And I mean, I've had a lot of massages in my life, and I think I might have even told you, like, that was different. What this woman does is different. So how are you?
I'm doing great. Thank you for asking.
Yeah. All right. So she's got to practice now. And tell me a little bit about where you are. You're right off. I think I get off Gilbert Road to get and see you, don't I?
Yes. And in fact, we are about to get an entrance from the 202 on Lindsay. So I'm actually between Val Vista and Gilbert on Lindsay Road in the 202 here in Gilbert, Arizona.
Love it.
I've been here for about 4 years now. But I've been in the massage industry for 18 years. Can you believe that?
I can't believe it. You're that good. So we're going to talk about a number of things here today regarding massage. One of the things that she specializes in is baby mamas and pregnancy and women that are, you know, both trying to conceive and then trying to have a healthy pregnancy and take it to the end. And so we'll spend some time visiting with that. But I wanted to start here. And here's where we're going to start. I was in, maybe it was a meeting, maybe it was like some brainstorming session. This was like 2 years ago. And somebody says to me, it was a doctor that was talking, and he says, you know, in China, people go see a massage therapist before they go see their doctor. And I said, that sounds like one of those things that people say about a generalization about people. But then I poked into it a little bit more. And, you know, while it's not the universal truth, there are many, 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 many hospitals in Asia where the first floor is massage. And that is really the first touch point with people. So what do you know about massage that most people don't?
It's not just, well, yeah, it doesn't have to be just a relaxing, make you fall asleep, feel good type of thing. It is something that can be corrective, and can help you on a emotional level as well as an energy level, or however you want to look at that.
Yeah. Okay. Let's talk about the first thing you said, which is corrective. It can be corrective. Yes. Give me an example of what you mean by that.
And
you can use mine if you want. You've done a lot of body work on me, so you feel free to use me, and we'll blow up any patient confidentiality here.
Totally. Well, like low back pain. We'll just, you know, that's a common thing that people go in to see. Low back pain can be caused by anything, really. It can actually start from imbalances in the ankle that move up the leg into the hip, into the low back, and then you have instability in the low back. We can
And
go
so how
neck
would
and shoulder.
you correct that? So let me pause you and say, okay, if somebody's got that going on, how do you correct that?
Me personally, I look at you 360. We're going to do work from front to back, because anything that you do on the front side is going to affect the back side and vice versa. But I generally take it in strides. We're going to do a treatment plan. We're going to work certain areas for a certain amount of time. And it's really like pulling back those layers, if you will. Obviously, muscles are not, they're stacked on top of each other. They're not just laying there, really. So we've got to pull back one layer at a time in order to get to that root cause.
Certainly. What's so cool about Dee is that, man, she's like aggressive, and she's got all these cool body pillows and stuff. And she's like, I'm not kidding. I love it. It's my favorite part. Like, she'll put this body pillow on. She'll be like, okay, I want you to put your leg up here and this foot down here and your arm over here and your neck right here. And it's like, what? And then she gets in there and starts doing something. You're like, okay, well, how come nobody's done that to me before? And that's what you're trying to do, essentially, right? Get in there, manipulate those muscles, calm them down a little bit, because what's really happening? Everybody knows knots. What's really happening when I've got a knot?
It could be a couple of things.
Okay.
The way I like to describe it is, it could be, we talk about toxins in our body. It could be a buildup of what we call lactic acid that has just, formed in a spot. A lot of times we like to talk about myofascial tissue, which is that connective tissue, or that first layer that surrounds the muscle tissue, which is a protective layer. And it's kind of like when you're spinning a rope, and when you spin it and you spin it and you spin it, and then all of a sudden you've got the big ball or the big knot on the top. Our muscle tissue is doing that exact same thing with repetitive motion. You're twisting the rope, you're twisting the rope, you're twisting the rope, and then all of a sudden you got that big ball. And then just fascia in itself, rubbing against each other, that constant friction can cause like that glue-like sensation. And all of a sudden you've got lack of movement within the movements, because essentially they're glued together. So that's a lot of what my job is too, is ungluing things, and taking that fine knot in that jewelry that we all hate and slowly undoing it.
I want to ask you what kinds of things people should consider massage therapists for. I think we are pretty one-dimensional. You may feel this way, at least I do, is that most people think relaxing, I'm going to go get my neck and shoulders taken care of, right? Or I'm going to go get some reflexology, or I'm going to go spend a day at the spa and I'm going to get the gold elixir facial, all these things are going to happen, and all that stuff's great and it has its benefits. But what kinds of stuff are people dealing with that they really should consider massage therapists for? Right.
Well, I guess the best way to look at us is we're muscle specialists.
Yeah.
So really anything muscle wise, your massage therapist really should be able to handle. We talked about low back pain. You talked about neck pain, headaches. All of that stuff is really muscle related. Let us kind of work with you first, and then we can get you in to see the right professional. If it's not something a massage therapist can do, then we will direct you to a surgeon or a specialist, depending on what that problem is.
And that's a good thing to say, and really to reiterate too. It's like, if you're having these constant headaches all the time, you should consider massage, consider what they might be able to do for you, because I don't know how many of the people that watch this thing are like me or listen to this thing are like me, but I'm somebody who will really try to handle it pretty holistically before I'm going to go and call my family doctor. Like, I'm probably going to try a couple of different things before I'm on the phone with Dr. Fishbeck going, hey, buddy, I need to come in and see you, Yeah,
totally.
Yeah, right. And I know you kind of appreciate people like that, because that's really the work that you love to do, right? When somebody brings you an intentional situation and they really want to work on it.
Right. I'm generally the person that they come to after they've tried all that stuff. So if we can change the pattern to come to see me before, that would be really cool.
Well, Okay, well then follow my suit, everybody. I'm telling you, it's the first thing I think about, and it's based on some training that I've had regarding emotions and how they stack up in our bodies and how that stress can kind of turn into, let's just call it crap. I'll keep it pretty low level here. And if we don't work through that, it compounds, it becomes worse. It layers up, right? And so oftentimes you just need to, I like to use this expression, let a little air out of the tires. Go get some body treatments done, reset your nervous system, calm your body down, and then let's start to see what tapers down as a result of that. Is that ringing true so hard for you right now?
Oh, totally. Yeah.
I don't know how to get people to know that other than to keep educating people and say your emotions are your aches and pains usually.
We use the phrase, the issues lie in the tissues.
I love it.
And it's very true. It's very true.
Well, let's switch gears a little bit and talk about moms. It's one of the things that you're really passionate about. I know you are a mom, so maybe that's part of it. I'm going to go out on a limb and say you even had a mom.
I did.
Yeah, right. So
I do. So, she's still here.
What? Yeah, cool. Mine too. So, what are you trying to help moms accomplish in your work?
Well, I just want them to have the birthing experience that they always dreamed of, and also I've had struggles in my own mother journey, if you will. So just helping people navigate that. There's not a whole lot of information or support as far as a lot of the things through the motherhood journey are, or the beginning stages anyways. And we already know there's no book to parenting, and there's really no book to fertility or your maternity period either. So I just want to be another form of support during that process. And I know how important that's been for me during my process.
So let's drill in and get a little specific. What kinds of things do you think, if a mom is like, what kinds of things do they struggle with that people come to you for?
Well, I'm a fertility specialist. So unfortunately, 1 in 4 women struggles with fertility issues. And when I say fertility issues, that does include endometriosis, PCOS, undiagnosed fertility issues, people going through the IVF process. It's all a very, very, stars have to align in order for a woman to be able to become pregnant. It's really not like they taught us back in school where you guys just do the dance and you're done.
Yeah, certainly. Okay, so that's one piece of it. They're struggling to get pregnant. That's going to be the first person that. So how does massage help out in that department?
Well, I have adopted an ancient technique that the Mayans used to use, which is called the Mayan abdominal massage, which it does so many amazing things on its own, but specifically,
I'm just thinking about digestive and gut health.
Well, and you hit it right on. That's a lot of what we do with the male clientele that we use that technique on, is to help with their digestive systems. As far as fertility goes, it helps increase blood flow. Some of my personal testimonies, as far as the abdominal work goes, we've seen an increase in the uterine lining. We've seen fallopian tubes that were blocked become unblocked, or fallopian tubes that weren't releasing eggs now all of a sudden release eggs. And it's a lot of the same benefits that regular massage give you: increased blood flow, relaxation, opening up of the pelvic region. We've also had some emotional work that has, working through, again, issues in the tissues, some of the trauma. Unfortunately, the lower area, we as women we deal with. Well, and all of us, that's our center. That's where everything comes from. So there's trauma there too. So there's lots of layers that we're working through there. Again, going back to the layer thing, it's not just muscle. There's all kinds of different things we're working through with that.
Well, and you're saying the issues in the tissues, and you touched on something that I'd like to expand on a little bit more, because I don't know what the current numbers are, but I remember once upon a time reading like 60% of people have had some form of sexual abuse in their life.
Totally.
And it's probably higher. It's probably more women than men,
Mm-hmm.
if we're playing on certain stereotypes, right? And so the work that I'm doing now, what I'm learning more and more is that trauma can get really stuck in you, and it can be, and you're holding it there in that region where you're hoping to create a child. You're holding all of that stress in the very area that you're trying to activate so you can get pregnant, and you can see where the disconnect is. And so it makes perfect sense to me, and I hope it makes perfect sense to other people, that if you were to go get massage, if you were to work on the root of the problem, which is to kind of break up all those issues in the tissues and get some flow down there, that's probably when you start to see success in your field, right?
Exactly. Yes.
Yeah.
Totally. Nailed it.
It makes perfect sense to me. I hope that starts to make perfect sense to a lot of other people too.
Yeah.
I don't know how much more clear to be about that part, right? Like, because, listen, I have friends that are trying to get pregnant right now, and it's really stressful. And if we're being real, and I know you're somebody that I can be real around, there's a lot of identity that comes into play when you can't get pregnant as a woman.
Totally. Yep.
There's body image issues that are going to come into play. There's self-esteem issues that are going to come into play. There's people are looking at me. What are people thinking about me? There's all this exterior stuff that's getting put on you. Guess what? Making it all that much harder to get pregnant. You're stressed. And that's, again, to tie it back to what you do. This is why the massage therapist comes in. So what would you do for somebody specifically who had maybe had some trauma, some sexual trauma? And, I think when I've come to you in the past, and everybody knows my story, I got exposed to porn way too early as a kid. And as a result, there's a lot of junk in my hips, and I've always had back issues, hip issues, leg issues, you name it. So I know what you've done for me, but tell them what you kind of do for people that are stuck there.
So this is where being a massage therapist with multiple, what we call modalities, is great. I actually call them tools in my toolbox or my tool belt. And this is where a Reiki session, which is energy work, comes into play. And it's a lot of you and me doing that work together. First and foremost, I want to ask your body for permission to enter that space.
Yeah. And
there's a lot of times where the body will just say, hey, you know what? I'm not ready. And I have to take that as, okay, we can't work on this space right now. Right. And then there's times where the body is like, I have been waiting for you. Please, I am ready to open the floodgates. And a lot of that is just what I'm feeling under my hands. And I just let people move through it. And again, it's all about creating that safe environment for them to have those emotional releases, for them to be able to work through it. I always tell my patients, you can share as much or as little with me as you want. I do get visualizations sometimes. I also get kind of voices in the back of my head. So that might be trying to tell you something. So if any of that comes up, I'm very open about that stuff.
Well, you're a vehicle, you're a channel,
I am.
And I think anybody like you that's in the energy space and in movement, and I myself know this, you can feel it. People like us can feel energy.
Totally.
I can be with certain people who are clueless, but I can be with people and like I could go to lunch with you, and somebody could come into the restaurant, and both you and I would be like, whoa. We could both see that, right? And you could be with 100 other people, and they wouldn't even see the person walk in the front door. But you and I are so keyed into that kind of thing. It's like we would both be like, okay,
totally.
Who's that?
I do have permission to share one of my fertility stories, and it did happen to be a patient who was going through IVF, and we did have one fallopian tube that would not release anything. And after doing several treatments of Reiki, I kept getting cold sensations as we were going through her treatment. And then I started getting the visualizations of a little girl in a room, and it was just a dark room, and there was a fireplace, but the fireplace wasn't lit. And she was in a hood and just sitting kind of dark in the corner. So I happened to mention to her that these were the visualizations that I kept going, or that I kept getting. And I had no idea that she was working through some stuff on the table, but she had had some sexual trauma as a child. And it was her in that robe sitting in that dark room, and she was afraid to take essentially the cloak off, and, you know, afraid to open this space so that, you know, she could let go of what had happened to her as a child, which she had essentially thought she had dealt with. And I had no idea, again, any of this was going on. But we were able to work through that. I was able to help her. And at the time, she was also working with a psychologist, which I highly recommend that when going through this process.
Holistically healing. I love it.
Yeah, totally. And we were able to get that fallopian tube to start pushing eggs as soon as we realized, okay, there's some trauma here that we need to work through. And the next time I would see her, the visualizations would change each time. Eventually the cloak came off. Essentially the color of the room changed. The fireplace was lit later on. It was really cool how it all kind of set up. And she is now 12 weeks pregnant. So very exciting story for her. And we are, you know, just, again, how amazing energy work was. And it was just allowing her to feel comfortable and in a safe place and allowed to be vulnerable and move through that, so we could open that space for that baby to grow and thrive.
That is such a great story. And I know you have so many more like that.
Yeah,
and
totally.
I'll tell you, to me, this is the benefit of healers. I had on this very podcast, maybe a couple of months ago, I had this woman, Patricia, who's a shaman. And I'm not going to give out any names, but long story short, somebody I know after the podcast was like, I got to go see her. Yeah. And they went up to have an experience with her and talk through some things. And I need to give you a little background. So a few weeks prior to her hearing me and Patricia on the podcast, she had been going to a couple of doctor's appointments because she hadn't been feeling really well. And they were talking about, you know, there might be an obstruction in her kidney. They were talking about, you know, maybe kidney stones. They were coming up with all these things that might be happening with the kidneys, right? And so she goes through her thing, and then she gets this meeting with my friend Patricia, and she goes up and she does the shaman work, and they're working together for like an hour. And Patricia is also a hypnotherapist, and so she kind of puts you in a hypnotic state, and she's doing some things, and so she takes care of my friend, right? She takes care of my friend, and at the end of the thing, my friend comes out of the hypnotic state, and Patricia looks over to her, puts her hand on her shoulder, and she says, by the way, I took the arrow out of your kidney. What did that do to you, right? Like
it just got goosebumps.
Patricia had no idea that was even a thing. She had no idea that my friend was even coming to her with an ailment.
Right.
And energy people, healers like you, have this incredible ability to hold space for us long enough to heal it and move through it. And I love stories like you just told and the one that I just told, because they're real. They happen to people all the time.
All the time.
All the time. Yeah. Amazing stuff.
Yeah.
All right. What else should we touch on for mamas and babies?
Well, I obviously do prenatal work. And then I actually just got my doula certification. So now I am actually able to help you through the labor and delivery process, and we can do home births, or I can assist you and support you in the hospital situation.
Oh my gosh, look at you.
Yeah.
That's so I mean, I can't even, I've only been in the room twice for the birth of a child. Both times they ended up being, you know, C-sections, but which was so tragic for us. We were one of those people who I loved it. You said up front, like we would love to help you live the birth plan you eventually had. Right.
Right.
I love sharing the story about my son, Gordy, because he's still this way. But, you know, when Gordy was coming out, he was like upside down. He wasn't coming out. My wife eventually had to take the pain medicine because the labor was so long and so intense. They put this suction cup on him. They tried to take him out that way. The thing popped off his head. And blood went squirting everywhere. And the next thing you know, like we're in an emergency C-section taking the baby out that way. And it was like our birth plan was to have him in warm water with some music playing. We didn't get that.
How quickly that goes out the window. But how cool would it have been if somebody was there just with a hand on your back saying, we're going to get through this, Matthew. It's going to be okay. She's going to be okay. And I'm not just supporting moms, I'm supporting dads too.
Yeah. Well, there's something really cool about being able to do it where you want it. And I don't know what the statistics are, but I would guess statistically, the numbers are fairly low of the women that actually need to be in a hospital to deliver a baby.
It is very low.
Yeah. What do you know about that?
I couldn't tell you the numbers exactly. But I
would say less than 20%, wouldn't you?
Yeah.
Again, this is.
I mean, it's amazing that we've been birthing babies in cornfields for how many decades without any medical intervention.
Yeah, listen, I just saw a TikTok video yesterday, and a woman had a baby in an elevator. So anything's possible.
Yeah. Cars, elevators, buses. You know, like. I think we've just developed in our minds that the hospital is, you know, that's kind of what we've been indoctrinated with. It's hospital birth. But,
well, there is that whole thing of like, what if, right? The what if something goes wrong, the people are close. But again, that number is fairly small. And how do you alleviate that fear? Because I'm sure that must come up around your work as a doula.
Oh, totally.
Yeah. So what do you say to those people?
You know, it's just something we have to talk through. Yeah. What are those fears? How can I help? How can I help you get over those fears? How can I soften your mind? How can I ease? We do see a lot of cesarean sections right now, but that's really a medical provider choice. There are so many things that we can do to avoid going that route. But just in my own experience here recently, it's the medical team and they just don't like to see other natural providers come in and mess things up. It's kind of sad.
Yeah, because there's room for both. That's
there
what
really
I keep
is.
telling everybody. There's room for everybody at the table. Yeah, get away from this thought that it has to be one way or the other. It doesn't. Just empower people like Dee to do what she does, and empower people at Banner to do what they do. Great.
Exactly.
Everybody wins.
Yeah. Well, and we can all work together.
Final question, then I'm going to let you go. Okay.
Okay.
Why did you become a massage therapist?
That's easy. I like helping people.
Yeah.
Yeah. I like helping people.
I love it. Dee, thanks for being on the show.
Thank you so much, Matthew.
We have 3 goals with Learn from People Who Lived It. 1. To help you feel less alone. 2. Encourage you to seek out a coach, a therapist, a church, anyone who can help you get through your journey and find some healing. 3. When you're ready, share your story with us.